first. I can't believe you said that.
Oh.
No wonder you're like so upset at you. Professional. I couldn't tell you what I just said. That was
Hey,
really
Dr. Knight. Tyler, nice to meet you.
Good morning, Ty.
Nice to meet you. Mr. Mullen, nice to meet you. Ms. Gary, nice to meet you.
It's correct.
You can have a seat right over there, Tyler. Well, thank you for coming out today.
Thank y'all for having me in.
Okay, so Tyler, we are interviewing you for the Macaulay athletic training position. It's a new position, a fourth one that we're adding. So we want to go ahead and just get started. We've got some questions for you, and then some other ones that give you an opportunity to ask some questions for us as well.
Okay.
Obviously, you know we've got a very successful athletic program here at Macaulay School. We take it very, very seriously, including a successful football program. Our coach is very demanding and holds the athletic trainers very, very accountable for quickly rehabilitating the injuries, getting a person back out. Can you discuss your qualities and past experiences that have prepared you for this position?
I don't have any pertaining exactly to the football. I have worked with Alabama football before, but I didn't deal directly with Coach Saban. So I dealt kind of in the background of that. But as far as like job opportunities go, I did have some pretty aggressive bosses in my time, especially when I worked in Tuscaloosa. They demanded a lot of stuff, that demanded a lot of time of me, and they were pretty aggressive about what they wanted. And if you didn't do it right, they were pretty angry about it. And so my job was just try to keep the peace between us, them, and anyone that was below me as a supervisor. And just to make sure that all communication was done right and make sure everything was known to everybody for whatever level it was, whether it was my bosses knowing what was done and what we got done, and for my employees to know that what we needed to get done and why we needed to do it a certain way.
Okay, good. Anyone else want to add anything to that?
Specifically, have you had any other opportunities at any other places where you've been able to interact specifically with some head coaches?
I did with league baseball a little bit. We didn't have a whole lot of injuries that I had to deal with them, but just talking to them about daily rehab and talking about where an athlete may be in the rehabilitation process, about if they can go on a certain day or when they might be able to go for the next couple of weeks, and what they can and can't do during practice or during workouts or something like that. Those coaches, they were pretty easygoing. They kind of knew why we were there and what our job was, so they trusted us pretty well. When I had my rotation at Macaulay, dealt with some of the coaches, but it was not Coach Potter, wasn't the head football coach. It was usually some of the more laid-back assistant coaches, so they kind of knew, and they would relay that to Coach Potter.
Okay.
All right. What sets you apart from all the other candidates we've had interviewed for this position?
Well, for most entry level, I'm probably a little bit older than some of the new applicants you may have. I do have 2 degrees, 2 bachelor's degrees, one being from the University of Alabama, where I worked with Alabama football, so I got the big D1 experience with that, and knowing how to run a big program and knowing what it takes to, time-wise, to run a big program. And then coming to the university and getting another degree from here and working with a smaller school with smaller sports and understanding the smaller intricate things that I need to do in order to keep a program running well. Whether it's a big or small, no matter what I have, that I feel like I've kind of gained the skills to be an efficient leader for an athletic training program.
What specific skills do you think you gained at Alabama versus Lee?
Alabama, I got a lot of basics learned from there because I spent 2 years in the athletic training program. A lot of it was getting faster at doing things, so not using a leisurely pace, especially for football or for baseball when I was with the baseball team, because they needed stuff then and they needed it now. And so I had to learn how to pick my pace up, and especially tape jobs. Like, it may not have been the best, but it was an efficient tape job. So I was able to get my skills a little bit faster and learn quickly through a much bigger volume of clients coming through on a daily basis.
So thinking about the experiences that you've had, what would you say some of your weaknesses are that you would need to improve on?
My biggest one would be, or there's actually two, would be time management and organizational skills, because that's something that I struggled with pretty heavily as organization. As far as organization goes, I feel like I've gotten a lot better, especially in my last year and a half at Lee. Had really good staff and faculty that helped me out with it, gave me some few tips about how to just keep everything in order and make sure that I had everything that I needed, like whenever I can find it, or whenever I'm asked to find it. And for time management, biggest thing I've been working on is just setting deadlines for myself, making sure that I'm not spending too much time in the athletic training room and not wasting too much time at home doing nothing when I could be at work on time or having other things to have done.
Kind of tying in with the organization, when's the last time you did a full injury note and rehab note in your documentation system?
Usually I set aside about an hour per day when I'm at Macaulay during my rotation there.
Okay.
And I will sit down and I'll write down any soap notes or anything that I had going on for that day for any kind of clients that I worked with myself.
Okay, so the parents of our athletes at this school are well-known doctors, politicians, business leaders, and many of the athletic trainers' decisions are questioned by these people because they're very intelligent and influential. So how will you handle a situation in which a parent with a lot of influence, maybe they may even be a doctor or the team orthopedic maybe, or a primary care physician for some of the other athletes. So tell us how you to treat their child injured in a way that they don't agree with. So what steps could you take to prevent this from happening?
If it were to be a doctor or someone that has some kind of medical background, I would just talk to them as a medical professional because that's what they would understand. So I can't go to them like a normal parent and talk in layman's terms and say, okay, this is what happened. I would have to use very professional language with them and make sure that they understand that I'm also a medical professional and that hopefully trustworthy in their eyes, because that's what I want to be, that I'm taking care of their kid just like they want to take care of their kid. Other than that, like if it was not a medical professional, I would still have to use a professional language with them because that makes me seem as a higher authority to them, not higher than them, but as someone that they feel okay, this person can take care of what's going on. And it was like if it was my kid, I would want to have some trust into the person that's taking care of my kid medically, and so I'd want to portray that to them.
So at Macaulay, we live and die by tuition numbers.
Mm-hmm.
Right? These folks are donating a lot of money. They are paying a lot of money for their children to go to school here.
Mm-hmm.
There's some pressure there. There's some pressure for you to make them happy.
Right.
What happens when they're asking you to do things specifically you don't agree with, but there's a lot of pressure. A lot of pressure on, you got to balance this making them happy and at the same time standing up for yourself.
Then I would just have to look at any kind of morals. I do have a very Christian-based faith, and I know that Macaulay has a very strong emphasis on that as well. And when it comes to something like that, I would just have to trust my moral values. And if it came to something that I needed to talk to my superior, whether it was Jersey or one of the other ATCs, or if I had to go higher than that and talk to one of the athletic directors or one of the assistant deans or something like that, then just to see where I stand and what's going to hurt. Like if something that I were to choose were to hurt the school or were to hurt my position with the school, I would have to do something like that.
So with the student population you'll be working with, it's going to be a lot of middle school and high school students, which they can be pretty excited to build a new relationship, especially with athletic trainer.
Right.
And you know that we've had experiences in the past where that line, and other schools have had experiences where that line can be blurred, and there can be some questionable things going on. So how would you handle situations with students when you're in the training room or at practice that are, you know, obviously they're all younger than you, they're high school, middle school students, and they're minors. So kind of describe how you would appropriately deal with that student in that situation. If in whatever situation, athletic training at practice, how are you going to deal with that professional line and making sure that you're being professional but giving them the treatment they need?
One thing that I learned, especially while I was at Macaulay and even at Lee, is that there are athletes that I will bond with a little bit quicker because we may have more in common. And it may be like at a high school level, maybe a student I recognize myself with pretty easily as someone that I grew up kind of the same area as and had the same interests as they do. But as far as working with middle school and high school, I would have to set the boundary of saying that I'm the medical professional and that they're just still high school students. It's a little more difficult on the college level because I was the same age as most of them, maybe a couple years difference. So it's a little bit harder to kind of keep that difference in where you're saying, okay, I want to help them out more because I know them better and I'm friend or quote unquote friends with them. High school level, I could still be friends with them, but they also need to understand that I'm technically a superior to them, like I'm one of their coaches pretty much, and that's why we have them call us Coach Gunner or Coach Tyler or whatever we decide that we want them to call us. And that kind of sets the boundary of saying, okay, look, we're not going to go out and get dinner afterwards. We're just going to keep our relationship here at school, and it's a professional relationship.
So what would you do if you were kind of stuck in a situation where it's kind of after practice, after hours, everyone's pretty much gone home, you're in the athletic training room, and a couple girls walk into the athletic training room, close the door, and ask you for, some, stem, ice, whatever. How would you handle that kind of situation?
First of all, I would ask them why they need it and why do they think that they need it. If they don't have any kind of serious injury, I would make them wait until tomorrow because I am closing down the facility. And if I'm the only one in there, I don't want it to seem like anything else would be going on, whether even if I'm not doing anything, if I am just doing stem and ice, it still doesn't portray a good look for me to be the only male in there with 2 underage high school students. So I would either ask for one of their coaches to come in, if they had a parent with them, have them come, or just have them wait till the next day when I have more people in there.
Dr. Knight, what questions do you have?
Yeah, Tyler, thank you for coming today. I will just kind of tell you, you come solidly recommended by our athletic training staff here at McCall. You've worked with a good bit, so I commend you for the time you've, in your undergraduate second degree from Lee, spending it at McCall. They speak highly of you, that goes a long way. The question I would have is kind of along the same lines. I had 2 sons that went there, and I didn't really, as a parent, physician parent, so I wasn't on the staff at all. I was just a parent who happened to be a physician when my sons were there, and both of them were active in athletics. One played baseball, one played tennis. Both had injuries like anybody, mostly minor kinds of stuff. I didn't seek out the athletic training staff. I think at that time, that's been 20 years ago, but it didn't seek out. Jersey wasn't there. It was a guy before Jersey. Do you know his name?
I don't know his name
Yeah,
very well.
kind of was
I know he had been there for a while. I just don't remember his name.
Long time. So
Also an NATA Hall of Fame.
great tradition of athletic training, at McCall, as well as athletics and academics and a fine school. So what, I guess I'm getting to the relationship that you would have, your ability to communicate, your willingness and availability to communicate to parents, knowing that their parents are always just sort of intimidating.
Mm-hmm.
And I mean, they're parents, and typically they have an agenda. Their kids come first in their minds, even though they camouflage that sometimes. But the added deal that's been mentioned about the kind of the elite, expensive school, and often these kids have medical backgrounds themselves and think they know sometimes more than they really know about sports medicine or that particular injury. So I guess you just talk through, just pretend you're talking to me, and I've called you and introduced myself as Cameron's father, who's an ER doc, and I understand that he's having knee pain, can't play basketball, he's having a lot of knee pain. We think it's jumper's knee, right? And I don't understand why he can't get more playing time. When I examine him, I don't know if he's a little bit of a wimp, sort of, but I think if you be pushed through this sort of thing. How are you getting your information about limitation in play time? Who are you getting direction? Explain to me as a parent physician why my son can't play more and practice more.
Well, first of all, I just have to explain that that with your child's pain, like whatever he's telling me, I'm having to go based off of what he's telling me. I have to trust him on that because it's his body, so I don't know exactly what he's feeling. If he's telling me that his pain is getting worse and worse throughout practice, then I need to change something in practice or in workouts where he needs to do a lighter load to pretty much save him from further injury. With that jumper's knee, any kind of repeated trauma to that knee, so a lot of jumping, a lot of running, anything that's going to have a hard impact on on that joint, is going to cause further irritation to his knee, and it's going to make him have more pain, be a lot more stiff in the mornings, and just going to feel like he can't do as much. He's going to be a lot more guarded in games and stuff where he could get more injured if he's guarding himself too much. And so that's what I'm trying to prevent. And so with having him do limited practice, limited game time, I'm trying to get him more rest. That way he can do more rehab during the week and before games and stuff like that, so that hopefully we can have him at a more optimal level of playing.
Well, I'm playing the devil's advocate here, Tyler. So I understand that, I hear that, but is there someone else with some experience with doing this that can give another opinion about the timeline on this, that besides the athletic trainer in the field? What's your protocol for additional help in determining return to play?
Usually if we feel like there's something else that we need to refer to, we go to one of our doctors, whether it's Dr. Bruce or Dr. Billmore Smith, with the Erlanger sports medicine clinic. If we feel that he needs further evaluation, or if we have any kind of doubt in what we're seeing, then we send him automatically to them. It hasn't gotten to that point because we are pretty confident in what this is, and we're pretty confident we can get it settled just with some reduced or limited playing time, limited activity. If it continues to get any worse, if it continues to persist, then we may start looking into sending him over to Dr. Bruce to see if he can find anything else, see if he has any other kind of recommendations of what we can do.
Thank you, Tyler. You reassured me.
Does anybody else have any additional questions? I think we kind of answered number 6 already in one of the other ones.
It's kind of since we are a school that starts middle school up through high school, dealing with that particular age range, especially middle school, can be kind of challenging, in terms of how they handle injuries and stuff like that. How do you see, and also the parent aspect as well, but how do you feel in that role? You're at a middle school football game, or the 7th grade football team, dealing with them.
Can you repeat the question for me? I don't know if I understood.
It's as you get older, it's easy, how college age students, you can kind of be a little more upfront with them and judge the day or whatever. But in the past, my experience of working with middle school age kids can be very challenging, and especially in football where concussions are a huge topic now. Like, how comfortable and do you feel that you have to treat or deal with them differently than the high school students that you'd be dealing with at McCallie?
There is a difference with them. Between like the older high school, like juniors and seniors, I don't feel like there's that much difference between them and some of the college students because they are closer to the same age and may have still some of the same thoughts about injuries, whether they're scared of it or like they may feel like they know everything about it. Working with high school, I would have to be a little more upfront with them and tell them why, because they're going to have that Superman mentality where they can take on anything and they'll be just fine. And be the same for the athletes' parents, because they may feel like, oh, my son has 20 scholarship offers, they need to be playing so they can get 25. So they just have to be more upfront, saying, okay, this is why we can't do this, and give them reasons. So talking to them about second impact syndrome and stuff like that, where their kid's life may be at stake if they were to push a little bit harder than what we need to push, and if they were to go back to activities sooner than what they really need to. As far as middle school goes, parents, I would still have to be very professional with them because they may have some kind of background in medical, or they may, like we said, or they may be lawyers or have some kind of higher standing in society. And then with the athletes themselves, I just need to speak more in layman's terms and like kind of break it down where it's on their level and they can understand a little bit better about why they can't do certain things and what they need to stay away from doing. Does that answer the
Yeah.
question?
Just the different ways you're gonna have to communicate with the different age groups and like you said, the parents of the 7th graders will freak out more than the parent
Right.
of the senior, so.
Okay, well, that's all the questions we have for you, Tyler. What questions do you have for us?
Okay, so I know with Macaulay there is a big emphasis on raising young men because it is an all-boys school, and you have the motto of honor, truth, and duty, which I really enjoy because I feel like that's really what society needs is more strong men to where they're taking care of their families, taking care of society itself, like they're able to take responsibility for their actions. Would there be any other areas that I could help serve in, as well as athletic training on campus, where you could use me and just certain anything really?
Yes, as you know, our assistant athletic trainers have other jobs. They're not just the athletic trainers. They may teach or maybe involved in dorm life or things like that. We encourage our athletic trainers and really any of our staff to get involved in other aspects. You know, whether or not you're teaching, that's one thing, but there are a lot of clubs that you can be involved with. There's a lot of other organizations that you can be a staff sponsor, faculty sponsor. No, we encourage you to pour into these young men's lives more than just their athletic trainer.
Okay.